afternoon, everyone. I'm Dr. Rashmi Chaudhary, the Senior Obstetrician and Gynaecologist in Cloudnine Hospital, Bellandur, Bangalore. I have a working experience of more than 26 years in the field of obstetrics and gynecology. My area of specialization is the management of high-risk pregnancy and the complicated gynec surgeries. PROM is basically it is a pre-labor rupture of membrane. It is during pregnancy. Basically, the baby is surrounded in an amniotic sac filled with water called amniotic fluid. This amniotic fluid is basically a cushion for the baby, which protects it from the external environment, and it protects it from the external germs as well as the bacteria present in the outer environment. Normally, the membranes, they rupture just before labor or before the starting of labor, or it can be during the course of labor. So then when it ruptures after 37 weeks, there is no issue. But when it ruptures before time, before 37 weeks, it is called as a pre-labor, premature rupture of the membrane. It happens because there are certain risk factors for pre-labor rupture of membrane. The woman who is having repeated urinary or vaginal infection, here because of the infection, the membranes are weak and it ruptures. If they are having a repeated episodes of vaginal infection, bleeding in the early pregnancy, then also it can give away because it makes your membrane weak. If it is a multifetal pregnancy, or if it is a short cervix, if the maternal health status, nutritional status is poor, it can also lead to weak and fragile membranes, and membranes can give away early. Smoking and alcohol consumption further reduces the strength of the membranes. So how to recognize that? Whether it is a membrane rupture or it is a urinary leak or any vaginal infection which is causing excessive discharge. So once there is a membrane leak, it will be a gush of liquor which will flow out from your vagina, and it won't stop after that. It is normally confused with the woman that they leak urine during pregnancy because of the low threshold of the external urinary sphincter. So once the threshold is low, sometimes they involuntarily leak urine and they get confused. Sometimes there is a vaginal infection is much, and in that case, the vaginal discharge gets liquefied by the vaginal temperature and it comes out in the form of liquid. So they get confused. So I will always suggest, don't take your thoughts on that. Just go to the hospital emergency department. Your doctor will see and will start the appropriate treatment. But once there is leaking, it won't stop. Whatever you do, it won't stop. So what are the side effects of premature PPROM or PROM? The membrane ruptures before time, baby is exposed to the external environment. So it increases the risk of infection to the baby. It increases the risk of prematurity. It increases the risk of neonatal intensive care admission. As well as it puts a mother also at risk. There can be maternal infection. There can be sometimes when the baby is in a breech position, transverse lie, it can lead to cord prolapse. Sometimes there can be placental abruption, which is basically a premature separation of placenta because the amniotic fluid comes out in a gush and it separates the placenta. This is a very serious condition. So whenever you observe the situation, you should report back to emergency. Immediately, don't waste your time, use a sterile napkin and go to hospital. The management basically differs from the gestational age. According to that, like if it is more than 37, delivery is indicated. Between 24 to 34 weeks of pregnancy, conservative therapy is followed to improve the gestational age so that the admission to the neonatal care unit should be minimized. So how we do? We advise the patient bed rest. We do certain basic investigation like complete blood count, CRP, and we put them on antibiotic therapy, and we do monitoring of the baby's health status by the ultrasound as well as by the NST, and we give the antenatal corticosteroid. 2 doses are given to make the baby's lung mature. If at any point of time any deviation is there, decision for delivery is taken. What are the reasons for delivery? If there is any sign of maternal fetal infection, we take a decision for delivery, or if the fluid is absolutely leaked out, or in certain medical conditions like severe uncontrolled diabetes or severe hypothyroidism or twin gestation or breech, we take a decision. Once the gestational age is between 34 and 36 weeks of, then we give a conservative therapy with the bed rest, antibiotics, steroid cover for at least 48 hours, as well as tocolytics also sometimes we use, so that baby's lungs should be adequately matured, and then we deliver. By these outcome measures, we can reduce the perinatal morbidity and mortality.